Every now and then, I like to ask my clients the question, what do you really want? And they automatically reply when they're having anxiety. They say, I want to feel better. I want to feel comfortable. I want to feel normal again. Now, what I want to say is that people think that CBT will make you feel better. Now, I want to say something. To make that right, CBT is a fantastic therapy and with amazing techniques and tools that will not make you feel better. It will make you think better. As CBT says that when you think better, you will behave better, and that both of these will lead you to feeling better. You will feel more relaxed when you change the way you think. You will change the way you behave, and this will lead you to feel better. You will feel comfortable. You will feel normal again. You will feel confident again. And this is why CBT is very successful in reducing your anxiety. But it will not just make you feel better. CBT is not having the magic wands, but it will give you the tools and the techniques to make you change how you think. Now, as I said that, usually through my sessions, my clients and I, we work together in the session and we discuss the thoughts that we need to change so we can work on them and understand how we can change these thoughts. And the moment we change these thoughts, we come together again and start knowing how, if we change these thoughts, it will be easy to change our behaviors. And of course, vice versa. You can change the behavior if they're having bad behaviors or strange behaviors or behaviors that would trigger their anxiety without them knowing that. And when we start knowing and putting our hands on that behavior that needs to be changed through our sessions, we then start working together on the thoughts that needs to be changed as well. So when we get to both changing the behavior and the thought together, they will make the client feel better, more comfortable in any situation. Whenever they are facing a situation or they are facing some triggers in life, they would know how to react or how to respond towards these triggers. Now, I hope you picked up that our exercise for tonight, this fourth exercise, is enough for you to take your time and think and focus and think closely on which thoughts that you need to change and which behaviors that needs to be changed or vice versa, and the topic of avoidance. Now, our practice for tonight is all about avoidance because, as we said, avoidance actually feeds the anxiety and makes it worse. And I'm sure and I promise that most of you who are going through these symptoms of anxiety, or you're having, let's say, social anxiety or anything else, you are usually trying to avoid, as people usually like to avoid how they feel. They avoid situations, they avoid going to places, they use the avoidance as a coping mechanism in order not, again, to face their fears, not to face their symptoms, and to be in denial of actually having an issue. So our practice for tonight, it's for you to do. Now I'm giving you some questions to put beside these questions that we said prior. Please take these questions and answer them carefully. You don't have to lie to yourself. It's for you to reduce your anxiety. Now these questions, number one is, what things have you stopped doing since you started having anxiety? Number two, are there situations or people or places that you're now trying to avoid? Like if you're having an event, you're going to a wedding, or you are going to present, to make a presentation at work. Are you usually avoiding going? Or there are some people that you know that you're going to meet at a wedding or at an outing, in an outing. Are you trying to avoid even seeing these people? So you'd rather stay at home and excuse yourself than facing these people or going to these places? This is very important to answer. Now, the third question is there any place that you used to go to, very comfortable, feeling good with yourself, but now you cannot go to this place anymore? Is there a place you cannot go now? Now, our fourth question, the last one, is, what would you be able to do if you weren't feeling anxious? What would you do? Please, always, always take your time. Do not rush answering. And please use your pen and paper, because writing down your thoughts might bring you more thoughts than you expected. So please love yourself more and give yourself the chance to understand your anxiety and the cycles that you're having in order to help yourself reduce your anxiety, or actually beat it, not avoid it. So I am leaving it there. As always, thank you so much for watching, and I'll see you next time.